edition of Workforce Wednesday with Maryland Business Roundtable for Education. I am AnaLysa Sawyers, State Program Manager, and I am so honored today to be joined by one of our super volunteers, Miss April Lugo, who is a program coordinator for diversity, inclusion, and health equity with Johns Hopkins Medical. So thank you so much for joining us today, April. How are you?
I'm great. I'm excited to be here.
Thank you so much. So we've got a lot to talk about, I'm sure, from the perspective of Johns Hopkins. There's a lot going on with you guys right now, and that you stay pretty busy with the current state of the pandemic right now. So we want to talk a little bit about what actually your role is and how it's affecting you and your ability to do the work that you do. So I kind of want to start off with you telling us a little bit about exactly what your job title is and what you do in your day-to-day, and just, a couple of little things about how you got into this field.
Yeah, of course. So I'm a program coordinator for Johns Hopkins Medicine, Office of Diversity, Inclusion, and Health Equity. What does that mean? I get asked this question all the time because it sounds like a fake job. And so there's two parts. There's the diversity inclusion side and the health equity side. So I describe the diversity and inclusion side as kind of inviting everyone to a dance. So the diversity part is that we invite everyone, regardless of your race, ethnicity, sexual orientation, gender identity, whatever makes you unique, you're invited, right? But inclusion is when you get there, right? Do you recognize the music? Do you know the dances? Are people talking to you? Do you feel valued? And so putting those pieces together. So at Hopkins, we want to make sure, regardless of who you are or where you're come from, you feel invited and you feel included when you're at Hopkins. And this is for our patients, our community members, and also our staff and employees.
Wow, that's really interesting, and it's really important because I'm sure that you probably have experienced this in your position. A lot of times people don't pick a particular hospital to go to because it's in a particular area and they don't feel that they'll be welcome there, or that depending on what their ailment is, that they won't be readily seen, or they won't receive the same type of care. So is that really kind of what you're describing there?
Yeah, it's exactly what I'm describing. So everyone has gone somewhere where they felt that they didn't belong, whether that's, someone's birthday party or a hospital or a mall where people are looking at you kind of weird, like you don't belong there. And so at Hopkins, we want people to feel like they can come to our hospital and know that they're going to get the care that they deserve. And that kind of brings us to the health equity side of my job, which is people mix up equity and equality all the time. So equality is treating everyone the same. No matter who you are, you get the same stuff. And it sounds nice, right? I treat everybody the same. But treating everyone the same is super unfair because we don't all need the same things. Right. And so if I say all my patients are getting insulin because one of my patients has diabetes, so you all must need insulin, doesn't make sense. And right. So recognizing that our patients are unique and they're different, and there's things that make them unique and special, and those differences are to be celebrated and may impact their health, and how can we help them and help all of our patients be healthy?
And that makes perfect sense because, again, no two people are alike. And so their ailments or the treatment course for their wellness shouldn't be the same. So that makes perfect sense. Yeah. So how did you get involved in this, or how did you decide that this is something that you wanted to do as a career? Did you kind of start out on this path saying, I want to go into diversity and inclusion? How did that come about?
So like most jobs, nobody wakes up and says, like, I'm going to be in diversity and inclusion when I grow up. So I want to backtrack. When I was in high school, I'm first generation to go to a 4-year college. And so college was this place like the moon, like everyone talks about it, but no one's actually been there. And so I remember when I applied to 10 random schools, and I was an obnoxious child. So when I applied to Hopkins, in my application, I wrote, I don't know anything about your school, and I don't really care if you accept me or not. But if you can help me be better, accept me. If not, don't accept me.
Wow.
And someone foolishly accepted me.
Lucky for the patients there. I'm sure it was a great choice.
Yeah, so when I was there, I switched majors 5-6 times. I switched career choices. I wanted to be a lawyer, and then a nurse, and then a doctor, and then an interpreter. And I think there's a lot of pressure for kids to know what they want to be when they grow up. And there's just so many jobs out there. And so if you want to be a doctor, there's nothing wrong with being a doctor, but explore that, intern with a doctor, talk to a doctor, because honestly, I would have never thought I would have ended up in diversity and inclusion until I took the internship in the office. And then I was like, wow, this is my passion.
That's awesome. That's awesome. And I think that that's an awesome bit of information. I mean, not information, of advice. A lot of times, people do think that when they go to college, they have to have it all figured out. They have to know exactly what they're going to major in from the time they hit the door, and that they never deviate from it. But a lot of times students don't take that opportunity, or that suggestion is not presented to them to, like you said, intern with someone that's in the field that you think that you're interested in, and really see what that work looks like. So bravo and kudos to you for doing that. So when you went to school, by the way, would you mind sharing where you went to college? Oh, you
So
said you went to Johns Hopkins.
I went to Hopkins.
You went to Hopkins. Okay. No, I keep, when I think of Johns Hopkins, a lot of times I think of, just the hospital and the medical.
Yeah.
And I keep forgetting that, Johns Hopkins is an institution in and of itself, not necessarily just germane to medicine. So awesome. So once you started this work, how did it start to impact you personally? Did you see that, oh my God, this is so much bigger than what I thought it was going to be? Or was it exactly what you thought?
I honestly had no idea what it was going to be. When I started, I was like, diversity and inclusion. My boss tried to explain what it was going to be when I started, and I couldn't fathom the depth and the reach that diversity plays in our institution. So everything, and it's everyone's job to be involved in diversity and inclusion. You think about diverse hiring and how diverse teams solve problems faster. They're more creative, right? They're happier. And so thinking about all those things, everyone should strive to be diverse and inclusive. Health equity, we should want all of our patients to be healthy. So at Hopkins, it touches every single one of our entities in all parts of our health system.
That's true. So here we are, pandemic. No one saw this coming, I don't think, in the larger scheme of things.
Yeah.
And with Hopkins being one of the premier medical facilities and entities in and of itself, how has this impacted the work that you're currently doing?
So obviously I'm working from home. You guys are in my house and most of us are working from home, following the stay-at-home orders. But it also has refocused a lot of people's jobs to COVID, thinking about how this has exacerbated a lot of inequities in people's lives. Before we saw that certain people suffer from diseases more than others, but now we're seeing how that plays itself out in the pandemic. You're seeing that people living in crowded houses, you have 10 people living in a 3-bedroom, and if one person gets infected, no one can go anywhere. They're trapped together. Or the people that are on the front line tend to be historically marginalized groups, right? Or looking at food insecurity or unemployment, there's a lot of stress, loneliness. And so trying to figure out how we can help and support our communities.
Has this transcended to your staff as well in terms of how they're having to respond?
What do you mean by that?
In terms of the other workers that are part of the Johns Hopkins facility with regard to, how they are having to respond to the pandemic, with not just the frontline workers, but just, other people that are in your department as well. Are they experiencing the same type of workload, or have any of their positions had to change per se?
Yeah, there has been a lot of people who are now they were working on something, but now their work has been refocused to help support the pandemic, which is great. I think it's really beautiful to see how an organization like Hopkins can kind of mobilize to help support the country. It's amazing to see that happen. We've also seen that a lot of our workers have been impacted by the pandemic, losing family and, their partners losing jobs. And so now people that were stable, they're stressed about food. So we started a food pantry at Hopkins for employees because we saw that it was an issue for even the employees working the front lines, that they were experiencing the same insecurities that all Americans are experiencing and the world is experiencing right now.
Wow, that's amazing that you guys are doing that, just to ensure that your workers are still feeling that appreciation and that support. I'm sure that helps them do the work that they do a lot easier as well. So someone that may be interested in, being in diversity and inclusion, or maybe they're not even sure. They just know that they want to do something along these lines that's helpful, and they're not sure how to approach that in terms of coursework when they're in school. Are there any types of courses when you're in school, now that you've been in this field, that you would suggest that someone might be that's interested in this decide to take?
So there's not necessarily a career track major of diversity and inclusion. I will say that because it is baked into all jobs and all aspects of life, anyone can practice diversity and inclusion and health equity all the time, right? So if people say like, I see this injustice, but we don't do anything to change it, if we all took action to change it, we would see a much different world than the one we're living in. And so for kids, how that can manifest itself is if you play a sport, who on your team isn't included when we have events, when we have games? Who's sitting by themselves? How can we include them? When we have our dance club or theater club or whatever club you're in, who sits by themselves and doesn't get to talk to anybody? And how are you including them, right? And so those are things we can do every single day and be change agents.
So it sounds like a mindset almost is what's paramount for kids to have. What about any specific skills that you've noticed that you think would be helpful to have in your job? I'm sure public speaking would be one of them, but what else, or if that even is one?
I think public speaking, listening, a lot of it is listening to each other. I think sometimes we assume that people have bad intentions, but everyone's just trying to do the best they can in the way they know how. And so a lot of my job is listening and talking to people and understanding how to come to a better ground and improve things. So constant improvement and constant work to getting to a better place, knowing that you might never get there.
That's interesting. So I guess another question that I have, as you were saying, that from a community perspective, how is your office, I guess, getting what you do and the importance of the work that you do out to the community? I'm thinking maybe a community where English is not their first language. How would they know what the purpose of your office is, or what you guys do that would be beneficial to them as a community, so that they would seek that healthcare and not feel those things like you were saying, that, oh, I can't go to Johns Hopkins because I'm not this, or I'm not that, or I am this, or I am that?
I think, like most hospitals, historically, we have had a negative relationship with the community. I think that's something that has happened and existed for a very long time. And that doesn't get fixed in a day. I think there's a lot of commitment. You know, being in Hopkins, our leadership is very committed to building those relationships and working with our communities. We want to make a difference and see that change. And even thinking about language, we have people who go out who are interpreters, who are bilingual, speaking to people, letting them know, we want you to come here and get healthcare and feel safe. Even, you know, when we saw a decline in immigrants coming to the hospital because they were scared they were going to get deported. Even though we don't deport patients, they thought we would deport them. So we had to go out and say, like, we're not going to deport you. If you're sick, please come to the hospital. We want to make sure you're okay. And so I think a lot of misinformation gets spread about Hopkins and what our intentions are. But I think I can speak for our organization and myself. Well, not the organization, for myself. We all want to help our patients be the best and be healthy.
Absolutely. Absolutely. So, couple of other questions. I promise I'm not going to hold. I know you got a busy day ahead of you. And again, thank you for being with us. So in that respect of making sure that they understand that there's, it's almost like a safe haven. It sounds like what you're describing. You want the patients to know that, having given those messages, are you now starting to see, or I'm sure prior to COVID-19, were you starting to see more patients have that trust and that start to develop those relationships with you, where they were coming in and you noticing that, you know, I guess the fears that they had were causing them to have longer medical problems or whatever, that hopefully, you know, having that relationship with them won't continue to happen? Did that make sense what I said?
Yes. Yeah. No, I think it's normal to be fearful. I think you know, people are sick and it's scary. Being sick is scary. And then making a decision that, where am I going to go to save my life, is a scary decision. And so that paranoia, I completely understand, being like, I don't want to go somewhere that even if I have a 1% chance of not getting the care I need, I understand that completely. And so I definitely, that resonates with me a lot. But I definitely have seen a growth in relationship building with the community, and it has been very intentional. We definitely try to get out into the community frequently and have these conversations and sit and talk and listen and hear. And bad experiences happen. I'm not going to say that you're always going to have 100% positive experience all the time, because things happen. And when we're in high crisis situations and you're trying to, process someone, being injured or being in an accident, they're bleeding, you're trying to, hurry up and deal with the trauma, things happen. But I get that. And so recognizing that we're not 100% perfect, but we care.
Right. So kind of going back to the whole COVID-19 thing, are you guys taking any additional steps, or as a staff or as a hospital, to kind of go into the community to kind of stress, if you're experiencing these symptoms, please come in, or giving them suggestions on how to safeguard themselves and minimize the risk as well? Because again, I'm sure with the language barrier, there may be some misinformation or misunderstanding that goes on in certain communities.
Yes, we have worked really hard to get interpretation services with our language access team in the clinics, because it's hard to understand with the equipment, the safety equipment on. It's really hard to communicate, even if you're speaking the same language, because there's just so much going on, the machines beeping and things. We do have people going out into the community, partnering with pastors and leaders and nonprofits who have those relationships and establish, that partnership already, to let them know that if they are feeling ill, to come to the hospital, get tested, make sure they're isolating. And so we have been having those conversations.
Good. I'm sure that that's helpful and kind of reassuring to those that, maybe have questions but weren't sure how to ask those questions because of a language barrier, or because of, again, that fear of coming into a hospital and not knowing what could actually happen to them from an immigration standpoint or anything like that. So as a community, what can students do if they're interested in, supporting the efforts of your office? Are there any internship possibilities within Hopkins in your department that would allow students that are interested in this kind of work, or again, as you suggested, want to see if it's something they'd be interested? Are there opportunities available for students to work with you guys?
Yeah, so we actually have a summer jobs program that Hopkins does, not just through our office, but through the entire Johns Hopkins Medicine and the university. And I think they take hundreds of students, high school students in Baltimore, and they pair them to different departments. So you can get paired in the president's office. You can get paired in clinical rotations, in chemo, in diversity inclusion, and legal. And then they basically pair you with where your interests are, mm-hmm. and you intern for the summer. And it's a paid internship.
Wow. So it's a paid internship that high school students can do. And they kind of get, like an overview of Hopkins in general, not just one specific area, but they try and take into consideration where your interests are.
Yeah. So they pair you, you're only in that one area that they pair you with your interest, but there's mm-hmm. a variety of different places you could go. And then they have, I think, either weekly or monthly professional development classes where all the students come together and actually spend the day in a class learning about resume building, wow. credit scores, all different kinds of development tools.
Okay. Would you happen to have the website or information where people could look that up? If you don't have it readily available, we can always make it available later on.
Yeah, it's called the Johns Hopkins Summer Jobs Program. So if you just look it up, there's a website.
Awesome. Johns Hopkins.
I'll send you the link later.
Awesome. I'm sure that there are a lot of people that would really be interested in that. And it sounds like an amazing opportunity, especially prior to getting into college, which may help some students decide exactly, where they want to focus on once they get there. So that's amazing. Well, Kola, I know you have lots of work to do. And again, I want to thank you so much for just taking time out of your busy day to sit with us today. Before I let you go, are there any last things that you would like to add just about the Office of Diversity, Inclusion, and Health Equity that you would want anyone watching to know about the work that you do, or the importance of the work that you do?
Just that it's all of our jobs to make the world more diverse and inclusive, and I hope that you guys come to Hopkins.
Awesome. Well, April, I want to thank you so much for spending time with us today. The information has definitely been invaluable, and again, it is something that we all need to make sure that we're doing and working together to make sure that everyone feels included, especially during a time like this where healthcare and taking care of ourselves is so vitally important, not just for our own personal homes, but just for the world at large, as we're seeing right now. So thank you to you and your team for all of the work that you guys are doing, and we tip our hats to you guys as well. You may not be on the front lines, but you're still definitely part of the front lines in the work. So we thank you for all of the things that you guys are doing. It's invaluable. It really is.
Thank you.
Again, to our viewers, thank you so much for joining us for our Workforce Wednesday. We want to remind you to please visit us on all of our social media platforms, which would be Facebook, Twitter, and Instagram. And don't forget to check out our Way to Be app, and just make sure that everyone is doing their part to stay healthy, take care of yourself, as everyone is always saying, wash your hands, make sure you're covering your mouth and practicing safe distancing. So again, on behalf of myself and MBRT and April Lugo, we thank you so much for joining us, and we'll see you tomorrow for our next session, which will be covering reality check with Chris Carter from the Internal Revenue Service. So for MBRT, this is AnaLysa Sawyers signing off. Thanks for joining us, guys.